Another question that we get commonly is, are leg cramps serious? Leg cramps are something that can happen in the muscles in the leg. It can be the thigh muscles, the knee muscles, the foot muscles, and it's not an uncommon complaint. Also, leg cramps can be from a variety of different causes. It is true that having varicose veins, or what we call venous insufficiency, can lead to vein cramping, but also other things can lead to vein cramping, like strenuous muscle activity, sometimes being dehydrated or having electrolytes, which are like the salts in your blood being off a little bit. So it's important to think of it holistically as a variety of different causes, but venous insufficiency is one cause. We don't generally think of them as being serious or life or limb threatening, but it's more of a symptom to tell you something's off, okay? And so what I generally will have people do is check in with their primary care doctor, who can check their blood work, talk to them about rehydration and that sort of thing. When we evaluate people, we generally start with an ultrasound, and we can see whether or not they have vein problems. We can look for blood clots, but more commonly we can look for what we call venous insufficiency, which is where the valves in the veins are not functioning properly, and it lets blood pool in the lower legs. And sometimes it's that daily stretching of the veins and weeping of fluid into the tissues that leads to swelling that can contribute to this cramping type of complaint that many patients have. If we see that, we'll generally start with a conservative approach, where we'll talk to people about exercise, elevation, and using compression socks to try to minimize that swelling. And for some people that will help. But for others, especially if it's more advanced, sometimes we'll offer them a procedure known as a vein ablation, such as radiofrequency ablation, venous seal ablation, varithena ablation. These are vein procedures we do here in the office, and when we do them, they can help reduce the amount of blood pooling in the lower legs. And interestingly, we see a lot of patients that come back and say that their cramping is less common, or sometimes it goes away altogether. So cramping is more of a symptom that you need to look into your leg health, and including your leg vein health. And sometimes you can find ways to help minimize that cramping.